2 months in, Mary, like 22 months, right? Well, more so than introducing myself, I am so excited to be introducing our amazing co-host for the day, Allison Cardona, who is the Deputy Director of the County of Los Angeles Department of Animal Care and Control. Allison, good morning. How are you?
Good morning. I want you to intro everything. You are like the ultimate hype man, Bobby. It makes me so happy. I'm so grateful to be here and to see all of your faces and start to kick off the week this way. So thank you.
Well, before I let you dive into the question of the day, you know I cannot help but splurge my love for you and your amazing story. So, for the folks that have not seen it previously, Allison Cardona also had a candid conversation with Mary Smith maybe a month or two ago now. Time flies during COVID. But Allison just dropped that link in the chat. I highly encourage you to watch it. It was one of the most inspirational times I've had in 2021. And Allison, I'm going to toss it back over to you for your question of the day.
Aw, thanks again, Bobby. And thank you, Mary, and the other Allison. It's always such an honor to be with all of you. So yes, question of the day. I think the thing that popped into my head is that what is one piece of advice or a suggestion you would give yourself from 20 years ago? Yeah, so I'm 45. I think about what would I tell my 25-year-old self? First and foremost, I would say to moisturize. My mother tried to tell me that, constantly, and I didn't listen, and now I'm feeling it. Yeah, and I think I would also say, you're okay. You are okay just as you are. So, but I'd love to hear from everyone else.
That is such a great question, Allison. Yeah, so feel free to use the chat, folks, or if anybody wants to speak up. Matt, my brother, I see you on the call as well. So if you have something, I would love for you to unmute and give us some thoughts.
If I could go back 20 years, I would tell myself in 10 years, there's going to be this thing called Bitcoin. Definitely invest in it then. Don't wait 20 years from now. The second would probably be for me to have a little more compassion and join animal welfare earlier. I found this profession a little too late, but then again, probably at just the right time.
Magic on a Monday from Matt. Mary, I think Matt's Motivation Monday sounds pretty good, close to Mary's Motivation Monday. But Allison, let's keep it rolling for a few more minutes. If you want to shout anybody else in the chat or pick on anyone, you're welcome to do so. Oh, it looks like you're muted. Allison, looks like you're muted.
Oh, sorry about that. Here we go. Try that again. I was going to pick on Javier Gutierrez, one of my great coworkers at LA County. What would you tell yourself 20 years ago, Javier?
I don't know. I don't know, because I would definitely do a lot of things different now than 20 years ago. I don't know.
I can think of something. I would say 20 years ago that you should have gone, well, love what you're doing now. And as a side hustle, you could have had a career in radio. Javier in Spanish, in English, has jokes, has a great radio voice, and does a great job representing LA County in the media. So there you go.
And Javier, not to spoil the surprise, but one of the reasons why I asked to meet with you is I'm going to graciously ask you to co-host one of these calls next year. So looking forward to that as well.
I think I'm busy.
All of 2022, bro? Come on. You gonna ghost me that hard?
No, that's all good. No worries. I'm there.
Thanks, brother.
Well, the one other thing I'll say is the fiscally responsible. Oh my gosh, yes. Can they please, when I see now anything for youth being taught about budgeting, balancing a checkbook, how to save, please, number one, do not need algebra, needed balancing a checkbook.
That's huge. And I keep trying to tell my 20-something kids that, because I learned it the hard way too. Like, that's so important right now. Just, yeah, I agree.
Yeah, and Allison, the one thing I'll add before we move on is as sort of the millennial in the bunch, it's 10 years ago, I would tell myself that likes don't define you, because I think at that time it was sort of a big deal. And now I'm very proud to say that I've been off of social media for about a year and a half. And guess what? No one misses what the fuck I've been eating for the last year and a half. No one cares.
It's much healthier that way.
All right, Allison, back over to you to toss it over.
Oh, great. Thanks so much. And let me just say, that's funny coincidence because I just decided this morning to get off social media. So look at that. All right. So now do we kick it to Mary Ippolita Smith for Monday's motivation, right?
There we
Can't wait
go.
to hear from Mary.
Thanks, Allison. Thanks, Bobby. This has been a great way to start the morning, because as I was getting my cup of coffee, I thought, Jesus, I have no idea what the fuck I'm going to say or what's going to happen. And then you came up with that great question. And I have to tell you something. I don't know if you guys read Boulay's blog post. What is it? Bobby, help me. I think it was something like nonprofit as fuck. Yeah. So he talked about the fact that he's reached a certain age where people ask him that question, what would you say to yourself 20 years ago? And so that one cracked me up, because even 20 years ago, I'm still older than all of you. So, I mean, that's a riot. I mean, literally, that is a riot. Okay, so I have to tell you guys something. I have become like this insane dog person. So I read this article in the New York Times last week, and this woman had adopted a dog. It was like a scruffy dog named Rascal. And every time she would take Rascal someplace, people would say, oh, what kind of a dog is that? Because isn't that really what people ask us? I mean, these are people outside of animal welfare. They always ask, what kind of a dog is it? And then they proceeded to tell her, you know, it was a Dachshund, or it was a Jack Russell Terrier, all these different kinds of things. She went to her vet, and her vet said, oh, Rascal. He's 100% Rascal. All right, that was a good answer. And of course, the shelter people said, one shelter group said, oh, it's a Chihuahua mix. And the other shelter group said it was a Terrier mix. I mean, come on, you guys, have we not learned anything in the million years we've been doing this? There have to be more answers. Okay, so this woman decided to get her DNA test, the dog's DNA tested. And I've never been a real fan of that, but what piqued my interest is the woman herself had gone through genetic testing because of some kinds of illnesses that were in her family. And she wanted to know, you know, whether she was going to, if she had those same genetic markers. And actually, probably about 3 years ago, I did the same kind of thing with genetic testing, because there were some cancers that were showing up in my family. And for my nieces and nephews, my brother said, why don't you go ahead and do it? So I did. So anyway, this woman had her dog DNA tested. So I thought, I woke up like on Wednesday morning and I said, we're getting our dogs tested. And my husband just kind of looked at me and it's like, wow, is this a dream, or are we really going to do this? I said, no, come on, let's do it. We went to Embark. I'm not trying to sell Embark. In this same article I read, the woman said Wirecutter, which is kind of like Consumer Reports for New York Times, had tested 17 of them, and they did Embark. So I signed up my 3 dogs. I paid a shit ton of money. Let me tell you, this is our Christmas present for the next 3 years. And these dogs now need to survive 5 years. So in order to pay it off. So in course, love and kisses and, you know, great behavior. So I got my kits. I had to put the swab, the cotton thing in their mouth. I'm telling you, 30 seconds sticking something in a dog's mouth seems like an eternity. It is unbelievable. I probably have done the whole thing wrong, but I did everything, went to the post office, sent it off. So now we'll see what happens. So even if the dogs come back as being like 100% super muck, I would be happy, because it was just such a freaking fun experience. And I'll tell you, sometimes in animal welfare, I don't feel like I have enough fun. And I feel like 2021 has been a year that's sort of unprecedented. I thought after 2020, I don't know what I thought about 2021, but I'll tell you, it's not anything about it. Anything I thought, none of that happened. Other things happened. It's just been kind of a mystery. And, you know, as Bobby said, here we are in the 22nd month of COVID, 22 months we've all been meeting, coming together, figuring out ways to keep our sanity in check and to do it in a way that makes us not want to take hostages with family members or coworkers, and really just try to be the best possible version of ourselves when the whole world feels like it is either on fire or collapsing. And yet we persevere. And with animals, I mean, like Matt said, he wishes he had started animal welfare a few years earlier, but also acknowledge that we get to where we go, whatever we get there, right? It's just the journey that we're on. And as Dr. Robertson told us a long time ago, we need to own our journeys. So I would encourage you all in this last month of 2021 to try to have as much fun as possible, because that's what I'm going to do. So with that, I'm out. Thanks, Bobby. Thanks, Allison. Thanks, Allison.
Mary Smith, I think I could taste that motivation today. It was so good. Just delicious. Thank you. So two things. One, I think you came up with the next official Haas pun for 2022, which is hostages. So I think Jamie Case and I have been hostages for the last 2 years, which I'm very excited about. Need that on a t-shirt. Two, my favorite thing in the world to do when I was working in an animal shelter was be in the kennels when people would walk by a dog that had no paperwork on it. And they would stop me and say, "Excuse me, what type of dog is this?" And I got to be so excited. And I would stop and be like, "You don't know?" And they were like, no, what is it?" I'm like, "That's a purebred." They're like, "A purebred what?" I said, "That's a purebred American shelter dog. And it comes with adoption papers." And they would get so freaking excited over that dad joke that I probably adopted out 500 Chihuahuas in my career. So if it's a Chihuahua mix, purebred American shelter dog with adoption papers, if it works, let me know. I'm going to buy you all a coffee. All right, Allison, back over to you.
Your dad jokes are giving me life this morning, Bobby. Thank you. And Mary, I love that. Thinking about joy is just so important. It's so important to celebrate and to really, I feel like that's so much connection when I actually laugh with somebody else and belly laugh with them. So thank you for that inspiration this week. Definitely going to take it to heart. All right, so now we're going to look for any national updates. Is there anyone who'd like to unmute and give us an update? And Allison, it looks like thank you for posting in the chat about a December 15th webcast with Julie Levy and Monica Frienden Tarrant. Hopefully I'm saying that right. Feline leukemia testing, one and done for everyone.
Thank you. This is an update for the AVSMA. We've applied for RACE CE. So anybody who's a vet tech might be interested in checking it out. Thanks, Allison.
Well, Allison, I'm super excited to be hearing Emma speak today, who is a rock star, but I know you also have a pretty cool presentation that you're going to be helping with on the Friday Maddie's Call. Do you want to give a quick plug for that as we're waiting for folks?
Sure, absolutely. So incredible to be joining Heidi Marston, who is the executive director of the Los Angeles Homelessness Services Authority, a city and county entity here in Los Angeles that is tasked with the enormous job of addressing homelessness. And she'll be here to talk to us. And also joining us will be Annette Ramirez, the Assistant General Manager for LA City Animal Services, and myself. And Heidi will be giving a fantastic presentation on homelessness and how they've addressed it and are addressing it in Los Angeles. And then we'll talk a little bit about how that applies to animal welfare and how we've started working together. Really excited for that.
And something that blew my mind about that data, Allison, which will be just a fun tidbit, is that 25% of folks experiencing homelessness live within the LA community. That's the fact, right?
Yes, it's true. It's basically like New York City and here and Los Angeles. So, but it's definitely things that anyone can apply within their own community. And I think important that we each think about it. Yeah. So Bobby, do you normally just wait for any more national updates?
I'm a huge fan of awkward silence, so we'll give folks about 30 seconds, and then we'll have you kick off the first presentation.
Actually, I do have something to share. So as y'all probably know, back from the middle of this year, the Found Animals Registry was acquired by Pet Health. We are merging to become the nation's largest free microchip registry. Now, this is not a pitch for us whatsoever, but I want everybody to know that there is an opportunity right now. We've been sending around a survey, a very mission-focused survey that I'm going to just go ahead and post in the chat here. There's just 10 pretty simple questions on there specifically around what we are curious to know that the community would like in a microchip registry, specifically pet professionals. This includes online portal, text message alerts, two-way interaction, all that stuff. So if y'all have maybe 2.5 minutes to take it sometime after this, please, I encourage you to do that. The more feedback that we get, the more that it helps redefine our mission and how we can launch this out in 2022.
Thanks, Matt. I personally asked Matt to make sure he came on to share this survey because, as we talk about reimagining the future of sheltering, we have companies like Pet Health. Last Friday, they came on and shared a ton of data with us and helped us really have a much larger macro view of what's going on in our field. And, if microchipping is something that you're passionate about, take the 2 minutes because really this is how we're going to see what the future looks like. So thanks so much for being here, Matt. So Allison, I think we're good and ready to rock.
Okay, let's do it. All right. So for our first presentation, we're so excited to have Emma Perez Singh here from the Riverside County Continuum of Care and she's an administrative manager. And they're really seeking to bridge the gap between homeless services and animal services through advocacy for co-sheltering, expanded homeless funding for veterinary care is such a must, pet boarding, and pet deposit and rental assistance. So Emma's going to be here to discuss why pet ownership in the context of homelessness should not be viewed as a barrier to housing, and what she's learned from moving from the animal side to now the people side of the work. So let's all welcome Emma.
Hello, everyone. Good morning. Thank you so much to Bobby for inviting me to come and speak to you. I actually just recently moved over from working in animal services for the last 8 years. I was working with Riverside County Department of Animal Services as the veterinary services operations manager. I also worked in other roles. I worked in the kennels, overseeing our kennel operations at one of our shelters in San Jacinto. And I also was tasked with building up our human animal support service programs at the beginning of COVID. And personally, I've always had a connection to this population. Just a little bit of personal insight. My family actually, as a child, experienced homelessness, and I was always involved in different homeless service charities. And so always just kind of had a heart for that population. And when I got the opportunity to work with our human service providers in my role at Riverside County Animal Services, I was really excited about bridging the gap between services that were provided to animals in our community and the humans, that owned those pets as well. So part of what I did in working in our human animal support service programs was creating a homeless outreach team. So initially, when we started our homeless outreach, it was really focused on enforcement. So we were having officers going out with our homeless outreach providers and, impounding any animals that were out in the encampments that no one claimed, or if we had received complaints of aggressive animals, we would go out and cite, and really heavy-handedly enforce municipal codes and licensing laws, et cetera, and very quickly realized that that was a mistake. We started to really see how deep the bond that these individuals had with their pets and vice versa. And really started to think about what could we do to help these individuals that have pets. Not look at the pets as a barrier for them, but really how can we strengthen and support these individuals that had these pets that meant the world to them. We started to work hand in hand with the housing navigators and brainstorming about, what services can we provide as a municipal animal shelter to support your efforts. And so we started to have conversations about, okay, let's provide veterinary care, spay and neuter. Let's help these individuals come into compliance, working with local nonprofits that would assist with paying for licensing, paying for spay and neuter, starting to apply for grants that would cover spay, neuter, microchipping, and vaccination. And building up that rapport with those individuals so that they would allow us to do this for them. And then eventually we found, okay, well, these pets are spay neutered, they're vaccinated, they're microchipped, but we still have the issue of people living on the street. And so what are we going to do to mitigate that? And as even people that are currently housed that have pets, we know that it's a challenge to find pet-friendly housing. That's just something that all of us in animal welfare know is a challenge. There is a limited amount of inventory. And so add on top of that, someone who has been experiencing homelessness for several years and may have a mental health issue or a substance issue, has an addiction disorder, that just adds another layer of complexity to the situation. So very quickly, we realized that we needed to figure out a way to care for the animal and give the assurance to the homeless person or the unhoused person that they are not going to have to give up their pet in exchange for a service, in exchange for housing, in exchange for going into a rehab program. And so we started a pilot program a few years ago with just a couple animals. And what we did is we boarded their pets at the shelter, at the animal shelter. And that worked out really well. We had a lot of resistance at first from our executives because they were concerned that we were going to have a bunch of abandoned animals. But what we found was that these individuals really did care about their pets and they needed the assistance to be able to care for themselves. A lot of them, we started with the very chronically, like the chronic homeless. In the homeless world, there are different populations of homeless persons. Your chronically homeless person is like the person that you're seeing sleeping on the streets. Like they're the ones that have been on the streets for a really long time. They may suffer from mental illness, they may suffer from a substance disorder, an addiction disorder. And so these individuals really need to go into some kind of rehabilitation program, and they are not able to care for their pet. Like there's not a co-sheltering option here because the person really needs intensive medical and intervention services. And so we started with those individuals and, gave them the assurances, working along with their case managers to let them know what was going to happen with their pet, where their pet would stay, the type of services that we would be providing, the type of enrichment that we would be providing. And these individuals started saying yes, and they started going into these treatment programs. So as we went out into our outreach, we really had a binary focus. So we started to have our person who was our human animal support person go out and start engaging these individuals about the types of services that we could provide and support, so that they could seek the treatment that they needed. And then we also still had not so much our enforcement in terms of like the officers going out and citing people, but just them coming out and starting to cultivate a relationship with the community, so that number one, if there was a public safety risk, that they can help address it. Because in some of our encampment areas, I don't know if LA is similar, but we have some pretty rural areas where there are like feral animals, feral dogs out there, or aggressive dogs. And so sometimes our outreach teams go into like these heavy brush areas, and we've had instances where people have been attacked. And so they do go out and provide that layer of public safety, but we're not going out there with the intention of like taking animals away or impounding animals. So most of the time, the officers are going out there and helping to build this relationship and this trust with the community. So in my role at Animal Services as the human animal, support person, I would interface a lot with the human service providers. And I would get very frustrated because I felt like, even though some of them realized that this was an issue, that owning a pet can be a barrier to housing for these individuals, I felt like whenever I asked for funding or whenever I tried to advocate for what we were doing, it was like, oh yes, thank you, but we don't have any funding for you. Or, oh yes, thank you for doing that. It's a nice to have, but there wasn't really an acknowledgement of how important this piece is. And it was very, very frustrating for me. And it felt like I was screaming from the mountaintops to an audience of, deaf people, like they just didn't understand. And so it started to really weigh on me. And and this is, I think, the piece that Bobby really wanted me to touch on, because he, asked me to talk about my viewpoint and my perspective while I was at Animal Services, and now that I'm in Human Services. Part of what happened when I transitioned into the role is I came into this thinking, yes, I'm coming into it and I'm going to be focusing on the humans, but I still wanted and had that desire to bridge the gap, because I came from that side, and knowing the needs and knowing the disparity there is for these individuals, and that there really aren't a lot of advocates in the human side. I wanted to be an advocate for this population. So coming into it, there's a lot to learn. There's a lot of funding. There are a lot of different programs. I mean, billions of dollars. But a lot of the HUD funding, all of the HUD funding, I would say, maybe Allison, I don't know if you are familiar with any HUD funding, but we've gone to our HUD state and federal representatives, and they've said point blank, we do not cover anything related to pets. None of their funding covers anything related to pets. And so what I found is that it's not necessarily that there isn't a desire to provide these services on the human side, or that they don't recognize that this is a need. What I found is that there are no resources for them to allocate to this particular need. And there are so many needs that these individuals have that, you go to like your hierarchy of needs situation, and to them, that need is way down here. They have so many other priorities that they need to allocate that funding to, that really the pet issue is down here, and they just don't have the time to advocate for it.
Emma,
And
I'm gonna pause you for just one sec. This is number one. Thank you. Mary and I were just private chatting how it's so refreshing to just have these like discussion dialogues. But I saw a couple people that I'm a fan of. Dr. Brianna, I know you were just on screen and you went off screen, but I hope that you're still here doing amazing work at the ASPCA, but also did a lot of work supporting the vulnerably housed. So I would love to get your thoughts on this. Sorry for like being a weird animal welfare stalker, but like I've been a big fan of the stuff that you do and I saw you on the call. So.
Wow, I'm so flattered. Thank you so much. It's great to see everyone. My name is Biana. I'm a resident at the ASPCA, doing my residency in shelter medicine. And yes, I have some experience, I suppose, with the population of people experiencing homelessness in Edinburgh in the UK. So I think, you know, that actually does everything that you've said. And I did just tune in really like maybe 5 minutes ago. So I'm trying to catch up a little bit. So I don't know how much I can say about everything that our wonderful speaker has said. But I've definitely found that there is a lot of excitement and eagerness to support even small sort of grassroots community-based projects. There's movement around that, but I think in terms of the big funding that we can get, at least in the UK, my experience was that that was very limited. And I think it was useful that we had the backing of a whole university, because what I was involved with was it was a pop-up veterinary clinic run by students that I know that there's several other wonderful examples of that here in the States. And again, the climate is different, you know, in terms of the politics in the UK and the US. So I don't know if there's someone else here that also has experience with, you know, people experiencing homelessness in that community and actual veterinary projects like the one that I was involved in. The one that I founded was called All for Paws in Edinburgh. So you should check it out if you get a chance. It's really cool that it's continued on after I've left. But I just want to definitely say that there's a lot of work that can be done here. And I would also recommend, I don't know how, honestly, I don't really know who I'm speaking to. There's so many people, but there's some really great literature that's coming out as well around this topic. So there's a review paper that I can put in the chat for you all to just have a look at, because that was extremely illuminating to me. And it was really looking at the social services component and how people experiencing homelessness and just the relationship that they have with their pets is so important to hone in on when being able to provide support for them, just as a part of this One Health model, but also how can we use the relationship that people have with their pets to provide better services to them. So how can we use, let's say, for example, if there is a community of people that, or someone that's experiencing or needing, you know, CBT or some type of, you know, mental illness treatment or support, using that relationship with their pet to support them in that way. So anyway, I have many things that I could say about this, but I also don't want to cut anyone off. So
thank you so much. And I know that you'll have a ton of resources that you can drop into the chat. I know that Sharon just put a great organization as well. My Dog Is My Home, that's been doing really amazing work that Emma's a part of. So this is me getting back out of the way. Emma, your show. Allison, I know you have experience too in this space, so keep it going.
I love, oh, sorry.
No, go ahead.
No, I was just going to say, I love what Brianna mentioned, because absolutely, you know, using that relationship as part of the trauma-informed approach is so essential. And sometimes, you know, the relationship that they have with their pet is the only thing that they have worth living for. And when you're able to use that to help them get to a place where they can say yes to receiving services themselves, I think it's just an amazing opportunity. And it really is, I think, the best approach to utilize. I think what I was going to say was, Part of the mistake that I was making in approaching this situation was that I was really coming from the animal perspective. And when you're talking to human service providers, a lot of them are more focused on the individual. And so utilizing, as Brianna mentioned, that relationship and demonstrating how important it is and how beneficial it can be to the human in that relationship, I think goes a long way in helping us to advocate for funding for this particular population. Allison, go ahead.
No, thank you. I get so excited. And I love, first of all, Emma, that you frame this from your own lived experience. So thank you for sharing that with us, and just like humanizing the experience. And also what I love about these calls is that it's connections, right? And so you're talking about your experience in Riverside. And as you're talking, and I'll make sure to get the link, there is funding available in California for service providers, for human service providers that want to accommodate pets. So there's funding available for veterinary care, for setup, for supplies. So we'll definitely make sure to get everyone that information. And while it's not at the federal level, it can be at the state or at the local level.
Yes.
And then I feel, Bobby, like this is such a great cue up for Friday as well, to hear Heidi Marston, because to hear an executive director talk very clearly about how important it is to integrate pets into services and to show how that can be done in low barrier ways, really, low hanging fruit. This is how you can do it. It doesn't have to cost a lot of money. It's just the power of connection and of sharing these resources. So it just gets me really excited for that. And Emma, I guess the thing that I wanted to ask you was really, I think especially in making the leap from animal services and bringing it to human services, what keeps you going? Because this is such a daunting, people experiencing homelessness and housing issues are so daunting. And what keeps you going? What keeps you motivated?
It's so funny. I was talking to the team about this just last week, and it's like focusing on the small wins. I mean, it's just like with animal services, sometimes there's days where you could just feel like the work never ends, right? And you have a lot of times where it feels like it's very thankless. But then you have these like little moments where, you're able to help an animal, severely neglected animal find a new home. And then you get the pictures of the pet in their new life. And it's like, wow, it was worth it, and we have those wins on the human side too, where you're actually able to, see the fruit of your labor, and it makes it worth it. Like just focusing on those little wins, like what win did you get today? And those little wins become big, over time. So I think that we need to just be very purposeful in looking at that and counting them. It goes a long way.
Excellent. Well, wonderful. Thank you so much for bringing your experience. And yes, my dog always eats first. There's so much literature and books, and just really get connected to this work. But I think the humanizing it and understanding the different levels is really important. So thank you so much, Emma.
Allison, I'm going to say, because now I'm like really excited and geeking out to give a tease of early next year. On the Friday call, Leslie Irvine will actually be joining us on a call the second or third week of January. We have her booked. So look out for that email as well. We're going to spend a whole hour with her just unpacking her story, her book, and all the things. So man, I'm already getting excited for 22, Mary Smith. This is awesome. All right, Allison, back over to you.
Okay, no problem. All right, so thank you again, Emma. And for our second presentation today, we have the Highway to Home program, and the Highway to Home coordinator, Jess, is it Outen or Uten? Outen? Yeah. Okay, great. So since 2015, the Gloucester Matthews Humane Society, GMHS, has transferred more than 4,100 homeless pets to adoption guaranteed partners through their Highway to Home program. And Jess is here to share how deliberate planning enabled the program to save the lives of more than 1,500 pets during the pandemic. And we're going to learn how GMHS revitalized their transport model to remove barriers to transport, create sustainable partnerships, and fund transports to decrease length of stay and broaden life-saving reach. Oh, welcome, Jess.
Hi, thank you for having me. So let me see if I can share my screen here. So let's see here. Okay.
Looks great.
Okay, perfect. Yay. All right. So as Allison mentioned, I'm Jess. I am the Highway to Home coordinator from the Gloucester Matthews Humane Society. I took over the Highway to Home coordinator position right about the time that COVID hit, actually March of 2020. So it was definitely interesting because I like to joke that I don't know what my job looks like not in a pandemic, but our shelter has made the best of it, and actually has really made the best of it with our Highway to Home program. So we're going to talk a little bit about that now. So a little bit of background about us. We were founded in 1912. We are a small private nonprofit shelter in Gloucester, Virginia. We have our current total intake for this year is about 1,700 animals. So 1,063 cats, 582 dogs, and other would be 84. Now, other can encompass everything from hamsters and gerbils to we have a chicken coop out back, and on occasion we get a goat. So there's a big range of other in there. Our humane care capacity is 113 cats, 43 dogs, and then about 4 to 5 cages in our small animal room setup. And again, the chicken coop out back. That does not include our foster program. We do have a small foster program. It's primarily for neonatal kittens and mom and baby groups during kitten season, which is, I don't know about you guys, ours is about 11 months long this year. So we do have that available. And then we also own and operate the Fixed and to Save Spay and Neuter Clinic in Gloucester. It is a public low-cost spay and neuter clinic, and they've performed nearly 4,000 low and no-cost surgeries in 2021. So Highway to Home, this program actually started in 2015. We've transported more than 4,100 animals to date, and 1,500 of those, and actually more now, have been transported since COVID-19 began. So a little bit of background. So funding sources for the program, obviously grants. We do have individual donors, private foundations as well. We do actually, because I have the most wonderful shelter management team and board of directors, we do have an allocation in our annual budget for Highway to Home. And then our CEO is also our big person for fundraising, and as needs come up, she'll do whatever additional fundraising we need to do to meet those needs. On the right here, I have some of our Highway to Home alumni. So I've got on the top left is Muzzy. Muzzy was a feral cat who lived 8 years in a feral colony. Turns out that once she came into shelter life, she was one of the rare cats who decided that she didn't really like being a feral all that much, and she much preferred being a lab cat. So she went on a Highway to Home, got adopted. That's her and her home. And then on the right is Mando. He is also, that's his first day in his new home after he went on transport and got adopted. Bottom left is a cute guy named Clyde, clearly working on his begging in his home. And then on the right is a very sweet cat named Kiara, who also, again, Highway to Home alumni in her home. Clearly, she made herself right at home. So some key successful partnerships that we've found. So basically, remove barriers, communicate transparently, build equitable partnerships, and cultivate buy-in from your stakeholders. So removing barriers. The idea here is that you want it to be as easy as possible for shelters and rescues to want to work with you. My favorite feeling is, when I'll get feedback from our shelter partners and they're like, I love working with you because everything's so organized, everything's right there in front of me. It makes it so easy. If I make that easy for them, they want to continue pulling animals from us. They want to continue helping the animals here in this county. So that's my job. we really pride ourselves on being, trying to always make sure that we're doing the best we can for the animals and for our partners. So one of the things that we will do is we'll utilize technology to make partnering with our shelter very easy. Electronic paperwork can be sent ahead of transport. So no more getting a big folder of paper, the day of the transport and going through and being like, oh my God, I missed so much of, I had no idea. I compile the paperwork usually about 48 hours ahead of time. I will send it off to the receiving rescue of the transport, and then they get a chance to review it. They get 48 hours before the transport to go over it, ask any questions they might have. Basically just, and obviously put it in their computer system, because that's always a fun thing to do when animals show up, is put like a billion animals in the computer system. Also, the same thing I do there is with transfer contracts. So they can be e-signed. I do it electronically e-signed. So no paperwork exchanging hands except for, a folder of rabies certificates the day of. That way, nobody has to remember to sign anything. Nobody has to remember that they have to take one of the copies and make sure the rescue gets the other copy. It's all just easy. And the focus is on making sure that the animals get from point A to point B safely. And then things like Zoom meetings for rescues. You can do this a couple different ways. If you have a rescue who's on the fence about a dog or a cat, that you kind of give them a little bit of information about their personality quirks, and they're like, I don't know. You can always have a Zoom meeting and let them kind of see that animal, check them out, see the way they interact with people, and that can sometimes be the difference between them being on the fence and them be like, oh, they're fine, they're good, let's go, let's take it. The other thing is, we have a rescue we work with frequently that will do transports, every couple of weeks. And sometimes they'll email me and they'll say, hey, we have someone looking for something very specific. Do you have a orange cat with no black on it whatsoever, not even like a speckle, or something very odd, some kind of very specific request? I'm like, yeah, of course we do, sure. And then I'll do a Zoom meet and greet with the potential adopters and the rescue, just a quick one, so they can see them, ask any questions they might have. And then if it looks like a good fit, we'll add that cat to the transport that we have coming up. And that's another life that we get out of here and into a home. And the other thing too is matchmaking is not just for adoptions. You really want to get to know your partners. You want to know what types of animals work at their respective locations. We have all kinds of partners. We have one partner up in Maine who loves pocket pitties, which is awesome because shelters are full of pitties. So we love that. We have another group up in Pennsylvania who loves hound dogs. And then we have some groups up in like the really like the Philadelphia area who are like, do not send me a German Shepherd. They cannot live in apartments, or not easily at least. So please don't. It does not work. I try to remember those things. We try to make notes on that, make sure that we are always keeping in mind what works best for our partners, so we can help to match make and make sure that they're receiving animals that really work for their community as well.
Hey, Jess, to frame this a little bit, thank you so much for that information. Do you share how big your team is for the Highway to Home program in this presentation?
So technically,
I think this is important.
The Highway to Home program is one, but I get an immense amount of support from the shelter staff in general. So kennel staff will be the ones to help me. They'll be here at 3 o'clock in the morning to send off 40 cats on the road to Massachusetts or wherever. So they help me load everything up and help me make crates. The medical team here obviously has all the vaccinations done and make sure my health certificates get done. So there is an immense amount of support across the board. But if you technically the building the partnerships part would fall under my job.
Thank you.
Yeah. So this is a kind of example of the electronic paperwork packet that I put together. So what you're seeing here is exactly what I would do in paper. I just don't have to do it on paper. I'm saving trees and sanity. So this is an example of a cat I actually did send to a rescue. So his first page is if any of you guys use Shelter Love, this will look very familiar to you. But the first page is the kennel card. I think it's a nice little snapshot, gives a clear picture of the animal, their basic information. And then following that with the next page or pages would be their complete medical history. I really like the way that this happens in Shelter Love because it's very clear. It's bullet point, section. So you can see very easily what vaccines have they had? When do they need them again? It's very clear, it's very neat, it's very easy for our partners to read. So medical would come next, and then we have our spay and neuter certificate and our rabies certificate. So for this is actually something that our spay and neuter clinic generates and sends back to us. So all I do is scan this into my computer, and then I compile the whole thing in Adobe Acrobat. This is nothing fancy. It is easy for everyone to use. It is accessible for everybody. There are free versions. There is a paid version of Acrobat now, but there are free versions on the internet. It's very easy to do. Anyone can do this. You could do it blindfolded. I promise you, it's very, very easy. So this is something that would be very easy to add and to make things easier on everybody. And then this is an example of my electronic contract. So this contract that I was able to create, we use this as, basically just says like this, these are the animals going to your, shelter from our shelter. So nothing fancy. This was created in Microsoft Excel. And I use Adobe Acrobat to have everyone be able to e-sign it. So one of the big things about that is, with Adobe Acrobat or similar programs, your receiving shelter does not have to have that program downloaded to sign. It literally just pops up in a nice little web page for them to sign. So no one has to have it in order to sign the contract. And then you have a nice record. Like I have a paper copy, but I also have an electronic copy for my records as well. So communicating transparently, we all know about this, so we won't spend a ton of time on this, but if you're marketing for adoption, that's marketing for transport right there. Simple as that. You're looking at good quality, unobstructed photos in natural environments. You want video clips to show personality, size, if they can do cool tricks, whatever. You want to be able to showcase that animal. The big thing for transport, just like if you're talking to an adopter, is always share anything that you know. So personality quirks, known medical or behavioral issues, or bite history, anything like that, you absolutely must be transparent. Trust is the foundation of building these relationships and keeping them going. I hope that most of our transport partners would say that we are always transparent to a fault. I would rather someone not be willing to take an animal on because they don't think that they're a right fit for it than take it and then call me one day and be like, what have you done? So absolutely, always communicate transparently. My awesome example of this is I have this dog here. This is Harry. This picture of Harry was his kennel card. Not a great photo. This picture got him to the rescue. And then building equitable partnerships. So I'm talking a lot about all the ways that the originating shelter can make themselves a better partner. A little bit, just a quick touch on this for some of the receiving shelters. Be an equitable partner, especially if you're receiving animals that are fixed, vaccinated, ready to go, and you get to put them right up for adoption. It's a partnership. So you absolutely want to make sure that your partner feels supported. So ways that destination shelters can help to build equitable partnerships, give back fees, which are great. No one ever says no to money, but there are a ton of other ways besides that for organizations that either aren't comfortable with that or aren't able to do that. Things like meeting halfway for transport, pulling unfixed animals, pulling animals with medical or behavioral needs, sending donations back with the originating shelter, or setting up a special transport in times of serious need. If the shelter's overcrowded and you have a shelter that would be like, hey, let's put up a special transport for you guys. Let's pull them in. Not everyone's able to contribute to partnerships in the same ways, but all contributions are important and valid. And my example here is this is Chloe, one of our dogs here in her cute little lobster costume. So sharing a story about one of our partners that actually checked off 2 of the boxes here. We have a partner that we work with that's every other Friday. We always, like clockwork, every other Friday, we do a transport with them. And it's part of a larger transport route. And so actually a couple of weeks ago, one of our municipal shelter partners was in a really bad state. We went and we pulled a bunch of animals, but then we were super full. And our partner was like, hey, I know it's an off week, but let's see if we can set up something and take some dogs. And they did. They ended up taking, I believe, 7 or 8 dogs total, which was amazing. And what they did was when they met us there, they actually had a third person there. There was our 2 drivers and they had a third person to meet us there with a ton of donations to send back to the shelter, which was such a neat little morale booster for everybody who had been really, we were putting in some work with these dogs. But this lobster costume was one of the donations. So we immediately put one of our dogs in it and paraded her around the shelter. And now you know the story behind that. So cultivating buy-in, buy-in from your board and your shelter leadership and your community is critical. For leadership and your board of directors, both your shelter management and board of directors, they have to believe in your program. That will be the single biggest obstacle. Funding is not your obstacle. Finding drivers is not your obstacle. Finding partners not your obstacle. The obstacle would be if your board of directors and your leadership don't believe in it. I am so lucky because our board of directors and our leadership are so in support of our program. They've seen it firsthand how incredible this program is. Actually, my 2 most active volunteer drivers are our on the board of directors, which is amazing. We've been really, really lucky. They've become incredible advocates for the program. They share stories about it with everybody. We just, and it's contagious. That attitude is contagious. It will catch on without the rest of the shelter. Volunteers as well. We have a wonderful team of volunteers here at the shelter, and we absolutely could not do it without them. They spend the majority of the time on the road with the animals. So that's wonderful. And then just more generally, the community and donors. Obviously, if your community is supporting it, that's a lot of your individual donors, your local foundations, that kind of thing. And then a quick note about shelter benefits. So as a result of our transport program kind of increasing, we've found that there's a lot less pressure on the adoption team. Instead of being focused on finding homes for a ton of animals who are all here and there's no space, it's more about finding the perfect match for our prospective adopters. So we were able to go to an appointment-based adoption program instead. It's much more conversational. It's much more about finding them the right animal for their life. And we have lower return rates. Our return rate has dropped from about 11% to 8%, which has been huge. Length of stay has decreased, which means, mentally and physically healthier animals. I don't have to tell any of you guys that, disease is rampant in shelters, unfortunately. And also too, it takes a mental toll after a while. So our length of stay has decreased 76% for dogs and 65% for cats, which has been incredible. And then we were able to expand our outreach to shelters and other rescue groups. So the example here is kind of what I call like a conduit shelter. That's what I call us. So we've been able to partner with several municipal shelters in our area. These are places where time and space are critical and they are often overcrowded. And so as a result of our transport program really taking off, we've been able to then go to our municipal partners and say, hey, we've got extra space or we've got space on transports, and we'll pull animals from them. A lot of them will fill open spots on transports if we have any. The rest will just be able to take up a kennel and go on to get adopted. So the biggest lesson here is commit to taking one action today. It seems like a lot, and it can be, but the reality is you can take some, little steps, and before you know it, you've built this incredible transport program. One of my favorite quotes is, Rome wasn't built in a day, but they were laying bricks every hour. So start laying your bricks today, whether that's, something as simple as downloading Acrobat and looking at how you would combine and compile paperwork. Maybe it's approaching a board member and being like, hey, let's start talking about transport. Or, perhaps it's just looking into researching some grants. Take a step today. I promise you, you will not regret that.
Jess, thank you so much. I think the one thing that I'm going to commit to today is finding a lobster outfit for my dog, because that might be the cutest thing that I have ever seen.
It was disgustingly cute.
I love it so much. We love your energy. We are so appreciative that you are here. I think what we're going to have to do is we're going to have to do a whole nother session with Allison from our team about just healthy, sustainable relationships. But since it is the top of the hour, I'll ask you to stop sharing this for now. And I'm going to just give a quick thank you to Allison Cardona for being an amazing co-host today. Allison, give us a quick final thought and then toss it over to Mary to close us out, please.
Sure. Well, I think in my final thought, I just want to give a shout out to Lorna Mejia Lopez, who is a dear friend and also a rock star director of Miami-Dade Animal Services. Just love seeing you on the call, and just connection, just keep connecting with each other. And Mary, I'll toss it to you.
Thanks, everyone. This has just been a really special session. And I think that as far as inspiration goes, one of the takeaways that I have from today's call with Emma and with Jessica and Biana and everyone is the value of starting the day with a gratitude list. I know that is just so corny, but it works. It really does. It helps, at least for this old lady, it really helps give that attitude adjustment that sometimes makes all the difference in the world. So I hope you all have a great week, and I'll see you probably Friday. Bye.